dilatation of the blood vessel. The third event is increase in the vascular permeability, and the 5 mechanism, we have just studied the 5 mechanism of increase in the vascular permeability. And most commonly it is seen in post capillary venules. Fourth one is stasis of the blood flow. Since a lot of plasma has gone out, the RBCs are concentrated here in the capillary or venule, basically the blood vessel. And here, since the RBCs are packed, there is increase in the viscosity. Blood becomes thick and it becomes sluggish. So there is stasis of the blood flow. These are the 4 vascular events. Now coming to 7 cellular events that can be remembered in a sequence. Why? Because sometimes in exams, only the sequence can be asked. So it is very important that we remember all the cellular events. See, these are the event. This is like a story. You cannot reverse any event, right? You cannot just say randomly that this happens. So it has to be a story. What happens? That some bacteria comes, it attacks like this, whatever happens. So it is kind of a sequence and you must learn everything in the sequence. So what are the 7 cellular events that you need to remember in the sequence? Because in exam, they can only ask the sequence of the events. So these sequence can be remembered at Mr. at Cop. Mr. at Cop. What are the 7 events? Margination, rolling, adhesion, transmigration, which is also known as diapedesis, C is chemotaxis, opsonization, and phagocytosis. Now let me tell you actually what are these events. Normally what happens if this is a normal blood vessel. In the normal blood vessel, these are the endothelial cells. Inside you find that cells are present in the center, and on the peripheries you will find the plasma, basically at the margin. Cells are present in the center, plasma is present normally. Now whenever there is acute inflammation, we are talking about the acute inflammation. What happens now when the inflammation starts? Cells first of all start coming at the margin. And which cell we are talking about? If we are saying acute inflammation, that means only one cell of acute inflammation, and that is a neutrophil, which is also known as polymorphonuclear cell or PMNs. So it is the neutrophil that actually comes at the margin. So first cell, that first step or first thing that happens is margination. That means the cell which are actually present in the center, they come out at the margin. And which cell? It is a neutrophil that comes at the margin. So it is the first one is margination.